and welcome to another show. There's a new PSA campaign called Flight to Flourish featuring Khaliah Ali. Highlights of the impacts of obesity, particularly for black women. So my special guest is Khaliah Ali. She's a healthcare advocate, activist, designer, author, and daughter of former professional boxer Muhammad Ali. Welcome to The Mark Bishop Show.
Mark, thank you for having me.
Khaliah, when you have 4 out of 5 black American women overweight or obese, and black Americans have the highest rates of obesity and severe obesity compared with other race and ethnicity groups, and notably 4 out of every 5 black American women are overweight or obese. Are we talking genetics here? Can you talk about this and the role that it plays in the other areas of one's health?
Absolutely. And to paint a broader stroke, 76% of all black adults are either obese and overweight. And to be very clear, this is an epidemic in our country and one that I too have personally struggled with. I can't speak to genetics, but what I can tell you that we know is that we do have socioeconomic issues and some cultural issues that we are fighting against within the black community. Some of these things we illustrated and highlighted in a personal matter during our roundtable that you can take a look at. It's available at familydoctor.org/healthy-weight. Once again, that's familydoctor.org/healthy-weight, or hashtag Fight to Flourish on any of your social media platforms. So we felt it was important to take that very, very important seminal first step, and that's talk about it, to break down some of the barriers and the walls that we can find ourselves in that look like shame or look like lack of access to community and tips and tools, and begin to take the first step forward in achieving for you personally what is the right choice. You know, everybody's different, and healthcare is deeply personal. What works for one person may not necessarily work for another.
Right.
A medical professional can help you determine the best plan for your unique circumstances. So identifying this for yourself and moving forward is really the first step. And I'm so thrilled to say and proud to say I've partnered with the American Academy of Physicians and Ethicon to begin a very important and ultimately possibly life-saving conversation.
Well, we're recording this in October, and of course October is Health Literacy Month. Why is improving health literacy, do you think, so important to lowering the rates of obesity in the black community? I mean, who are proportionate or disproportionately impacted by this disease? What are your thoughts on that?
I think it's all about resources and education and providing people with tools to make the proper decisions with their medical teams for themselves. And so we're able to provide that platform in addition to fight back and to share stories together. You know, a lot of this is about personal touch and touch points where you can hear your narrative and someone else's story and find that strand of hope and step forward. And we're so happy to provide that platform for you. And please, you know, when you go to hashtag Fight to Flourish, join us, regardless of your background. Obesity affects everyone. We happen to be highlighting, and I applaud Ethicon and the American Academy of Physicians for highlighting the struggle with my background, whom I am, a black woman. But let's be very clear, everyone struggles, and this platform is for everyone to enjoy.
Well, Khaliah, you know, life during the pandemic did put black Americans who were dealing with obesity at much higher risk. And it's now compounding these medical issues and posing greater health threat to the black community. Would you agree with that? And what has it meant for the black community and for the obesity epidemic in particular?
Well, certainly COVID impacted everyone across the world. I'd be remiss if I didn't say that, but it did disproportionately affect the black community, as well as, please note, those who are overweight. Obesity has a way of seeping into many aspects of our life that we don't necessarily even know how to measure. So, you know, I personally lost one of my best friends during this period of time from both cardiac and believed to be COVID symptoms and or combination. And so it's just far too real. You know, when you tune into the roundtable, you hear a lot of, again, personal stories. These women are so brave and wonderful to share. And, you know, during COVID, it was difficult to get to the grocery store. Sometimes just focus on eating healthy foods trapped inside of the house. There were some people who went from the category of overweight to obese after COVID. Much less navigating, of course, the gross loss of life. Those of us that were fortunate to make it through are still dealing with the effects of that physically.
Why is it, do you think, that it is so important to have an individualized approach to weight loss? And what does that look like?
So everyone has a different story. For some people, it's a personal injury that led to obesity. In my case, it's part of the family fabric, and it's a systemic issue. In other cases, some people found during COVID, they woke up and realized, that they were now unhealthy and overweight or obese. So, once you sit back and hear your own sound, I love to say going within. One of the great things my father taught myself was to have self-love and respect, not just for me, but for everyone around me. And that really is the first step, wanting to do something for yourself from the space of love and respect, and taking that first step into speaking with your medical team. And of course, participating in programs like Fight to Flourish, and listening to the stories of others, and receiving the pearls of wisdom and strings of encouragement to help you get in the ring and fight your best fight.
Yeah.
Because you know what? This is not, my friend, as we know, this is not a sprint, it's a marathon. I mean, I'm talking to you this morning at my lowest weight, and by all means, I'm not done. This is a lifelong battle. Obesity is a terrible, terrible disease. And for me personally, whether I've been losing or winning in life, you be very sure I'll always be fighting. And I really hope that's a collective. I hope to be fighting along with everyone else who joins us with Fight to Flourish, and then some with Ethicon and the American Academy of Pediatrics.
Well, in the spirit of Fight to Flourish, what advice would you give other women facing this journey right now?
I would encourage them to visit our website and to hear the stories of the other women and my story as well. You can hear more of my full story there at familydoctor.org/healthy-weight or #Fight to Flourish. And, make it easy. We're going to fight, but, in the beginning, we have to go within and really just accept ourselves as who and what we are, and be determined to find the healthiest path. And again, you should do that with your physician, what's right for you. I've had bariatric surgery. I am unapologetically proud of that, but I also understand that's not right for everyone. Regardless of that choice, you should start with your healthcare professionals or healthcare team, and of course, reach out to resources like Fight to Flourish for encouragement and inspiration.
Well, I tell you what, I want you to, if you wouldn't mind, just repeat that website again. I'll make sure it goes up. We're talking Fight to Flourish, if you'd give us the web address.
Yes, my pleasure. It's familydoctor.org/healthy-weight, or social media platforms. If you go to one of them, you can use #Fight to Flourish.
Okay. All right. Fight to Flourish. All right. Anything else you'd like to add just before we go?
Thank you for the opportunity. I just want to say again, it all begins with a conversation, an internal dialogue, and then stepping out and deciding what's right for you, and never giving up the fight, and know that you're not alone.
Well, you keep pretty busy as it. You have a busy life these days as a healthcare advocate. You're still an activist. You're a designer. What are you designing these days?
So I had a plus-size clothing collection for over 25 years. So again, when I talk about self-love, it's coming from a deep place, but at the same time, it has to be in concert with being healthy and happy. I'm proudly the mother of a Harvard grad and a decathlete, a healthy young boy. I was very careful because obesity has a way of reaching its hand back and claiming generations of families.
Yes.
So my son is healthy and happy. I'm a proud mama. And for my father, helping to curate his legacy with laudable causes, I work with a multitude of organizations, but perhaps most close to my heart is being an advocate for health, particularly for marginalized communities and those of us that are disproportionately affected.
Well, good luck with the campaign. You're doing a wonderful job. Thank you, Khaliah Ali.
Thank you for the opportunity. Thank you.
You're most welcome.